Good morning. So, this is part two of the shows that I've been doing this week on your doctor's visits and how important they are and how to make the most out of them and get the most out of them without losing your financial health to get your good health, your physical health. Today, I'm going to talk about when do you know it's time to fire your doctor? Now, remember, last Thursday, I did a show on customer service. And really, you are a customer when you go to the doctor, aren't you? You feed your doctor's children with your money. Your doctor works for you, not the other way around. I submit to you that I don't think we should be called patients, patients, because it also deals with patients. And patients, doctors, clients often have to really work on their patience, don't we? Waiting for a doctor to call with a preventive screening, a preventive, what is that? What does preventive screening prevent? It doesn't prevent shit, right? You get a mammogram, does it prevent breast cancer? Oh, I had a mammogram, I'm not getting breast cancer, whoopee. No, it doesn't prevent it. I don't think they should be called preventive tests, actually. They should be called cancer screenings, which is exactly what they're screening for. But I guess it sounds a little scary. Well, everyone knows that when you go for a mammogram, they're not looking for benign things. They're looking for cancer. When you go for a pap smear, they're looking for cancer. And just because you get a normal mammogram today does not mean that you're never going to get breast cancer. It doesn't prevent anything, but they call it preventive. And what calling it preventive confuses your doctors and your doctor's billing people. Because there's a big difference according to the Affordable Care Act and according to billing and insurance companies between preventive and diagnostic. And sometimes doctors mix them up. They'll code your visit as diagnostic instead of preventive, and then you have to pay for it. When in fact, you just went in for a annual preventive screening. God help you if you actually get diagnosed with something during that visit, then it turns into diagnostic. And then in some cases, that means you're responsible for the bill, even though the Affordable Care Act told you you weren't, because it's an annual exam. It's very confusing, the preventive and diagnostic. But when do you decide that you can't trust your doctor? Well, there's some signs. And the first sign starts with you. A feeling in your gut that you may not be getting the best care, the care that you deserve. And you deserve the best care. This is your health. This isn't, a contractor painted your wall blue when you told him to paint it yellow. This is your health, your life. So you do want the best care. So you want the best doctor, a doctor that you can trust. Here's the first thing I'm going to tell you. Don't always listen to the reviews. During the research for this week's shows, I spoke to a doctor friend of mine. He's really cool. And I promised I wouldn't name him, but if he's watching, he'll know that I'm talking about him. He's a great guy. I can call him with a question. He calls me right back. In between his patients, he'll call me on the weekends. He's awesome. And he made a comment, and I also have a friend who has a vet clinic who made the same comment. Unfortunately, when you look at reviews for a doctor's practice or a vet practice or a dental practice, you'll see bad reviews because people who have good experiences don't write reviews, and that's unfortunate. For me personally, if I have a great experience with a doctor, a veterinarian, a dentist, I make sure that I put on a good review. I do the same thing with restaurants, with contractors that I've used. I will write a glowing review. when I have a good experience, just as I am very apt to write a bad review when I have a bad experience. But I think it's always important to tell a business when they're doing something right and to tell others that I had a great experience. And I wish more of you would do that. It's so easy to say, well, I had a good experience. I guess everybody does. Unfortunately, there are people out there who write bad reviews just because they don't like the doctor, or they have a beef, or they're a disgruntled employee. So be careful when reading bad reviews. And remember that the people who had good experiences often don't. I'll tell you the best way to find a good doctor is talk to your friends. Talk to your friends. And if you don't think you can trust your doctor, think about what you were just your last visit and what your doctor said to you. Give you an example. In 2006, and I talk about this a lot, but this is really relevant in this situation, when I had my bad pap smear. Thankfully, I had people to talk to. I knew something wasn't right because I had never had an abnormal pap smear in 25 years of getting pap smears every single year. But Planned Parenthood, they freaked out. Oh, you need a biopsy. And then after the biopsy, oh, you need cryosurgery. And I'm like, whoa, whoa, whoa. Okay, I don't think I'm getting the same treatment that my girlfriends who have had the same exact situation have gotten. So I talked to my girlfriends. They're not doctors, but they had abnormal pap smears. And they said, Paula, that doesn't sound right. When I had my first abnormal pap smear, they just told me to wait 6 months because it could be a lab error. Oh, you see, Planned Parenthood didn't want to hear nothing about that. Their lab in Kentucky could not have possibly made a mistake. Well, it turns out they did. Huge mistake. Big, huge. And when I found out that my little pap smear was taken in Lancaster, Pennsylvania, and sent all the way to Kentucky, I thought, wow, anything could have happened to it along the way. Of course it's a lab error. What really pissed me off is they assumed, which doctors should never assume. If your doctor is assuming things that he's never tested for, like in my situation, yes, you have the HPV, the human papillomavirus. Don't blame your husband. Excuse me? I went through my bills because I always keep my bills. I don't recall ever getting tested for the human papillomavirus. Oh, look, I wasn't. You're assuming? First of all, your lab is perfection incarnate. It can never make a mistake. And now I have a disease a virus that you never even tested me for. Are you kidding me right now? So I called my girlfriends. And then I'm blessed. I called some doctor friends. Actually, I called 3. I have 3 doctor friends that I called in 2006. And all 3 of them had the same consensus. Wait 6 months. I know it's going to be hard, but wait 6 months and get another pap smear and actually get the HPV test, which is now available to women. And I did that. And guess what? Normal. Everything's normal. The lab in Kentucky made a mistake. Go figure. And again, that was in 2006. This is 2019. Some people said, well, you could still have the cervical cancer. Well, I don't think so. Because since 2006, I have had, 7 pap smears and 4 HPV tests, all of them completely normal. So yes, the lab in Kentucky made a mistake. The doctors at Planned Parenthood, well, they're no longer my doctors, of course. I immediately got my medical records. And when you get your medical records, this is the second big tip of today. Get your test results in writing. Any test result you get, you go for a pap smear, you tell the doctor, you mail me the results. Hard copy. Paper. And you put it in your files. A mammogram, you make them send you a copy. If I had had my biopsy result that Planned Parenthood insisted I had to have after one abnormal pap smear in 30 years of having annual pap smears, it couldn't possibly be a lab error. I never got to see the results of my biopsy. But based on that biopsy, Dr. Grant at Planned Parenthood wanted to do cryosurgery on me, which is a Band-Aid procedure, by the way. It's not a cure. A cure for cervical cancer is to remove your cervix. But of course, they wouldn't do that because I was still fertile. God forbid. A 41-year-old woman, 18 years on Depo-Provera for birth control, she may want to get pregnant in her 40s. Yeah, they're idiots. All of them. Yeah, preserve my fertility. But it's okay if I get cancer. Yeah, whatever. So at the end of the day, I fired Planned Parenthood and I fired Dr. Grant. And when I did, I got my medical records. And what they said the results of the biopsy was tissue insufficient for evaluation. And yet that was never a diagnosis that was given to me. When Dr. Grant called me on the phone, and I'm saying Grant because his daughter and I went to school together, and when they asked her name, she said, well, Grant is American, Grant is English, we're from England, so I'm Grant. So Dr. Grant, based on a biopsy that basically told him nothing except that he couldn't get any tissue out of my cervix during the biopsy that was even sick, he wanted to continue to treat me like I had a cervical issue, which I did not have. That's when you fire your doctor. But again, you have to see the results. You must ask for all your test results in writing. Because you don't have to be a doctor to know tissue insufficient for evaluation probably means there's nothing wrong with you. Or they didn't do the biopsy right. Either way, they owed me money. And they did pay me money, by the way. Planned Parenthood, when I threatened to sue them for all the stress they caused me, they did refund some of the money for the biopsy that I paid out of pocket. Yeah, Planned Parenthood's real cheap for pap smears and STDs and things, but you start getting biopsies and shit, they get real expensive real quick. Now, again, I don't want to trash Planned Parenthood too bad. They do good work, giving poor women birth control and STD testing and cancer screenings, and that's great. But again, you got to be careful. Because when you're a 41-year-old woman going to Planned Parenthood, they tend to treat you like the 15-year-old who doesn't know nothing. But see, at 41, I kind of knew stuff that most of their clients do not. And thankfully, I'm healthy. Knock on wood, my little cervix is healthy. And I did not submit to their Band-Aid procedures, unlike my poor mother. Now, my poor mother trusted her family doctor, too. She had the same family doctor for 30 years. My mother always had fibroid tumors in her uterus, always. And every time she would start bleeding abnormally, the family doctor, would send her for a D&C, a Band-Aid procedure. The cure for fibroid tumors is a hysterectomy. But this doctor never mentioned it. And I submit to you that that family doctor is culpable in my mother's untimely death in 2004 while she was having a hysterectomy at 68 years old. The reason she had that hysterectomy was because she started bleeding horribly badly, enough to make her anemic. And once again, the family doctor tried to get her for a D&C, but because of all the D&Cs she had had in the past, her cervix had grown shut. And he's like, well, only thing we can do now is hysterectomy. And to add insult to injury, the surgeon he recommended to my mother was a cancer doctor. He made my mother think she had uterine cancer, which she did not. And this hysterectomy doctor was awesome. I love her to death. I actually called her during my issue, and she called me right back. I was never her patient, but she called and gave me good advice about my pap smear issue. But my mother died because she had a hernia. Which again, if she had not had the hysterectomy, if she didn't think she really had to have this surgery, she never would have submitted to any surgery 7 months before my wedding. She wouldn't have done it. I know my mother. She would have been too scared. But because she thought she had cancer and she was hemorrhaging, she thought, well, I'm getting the hysterectomy, let me get the hernia operation too. And the hernia doctor is the one who ended up causing her death. But indirectly, this family doctor, who for 25 years knew my mother had serious fibroid tumors and never even thought maybe she needs a hysterectomy in her 40s, in her 50s. Nope, never even thought about it because the D&Cs worked. Band-aid procedures. Cheaper than a hysterectomy. Insurance companies love this doctor. So always get your lab results, first of all, especially if you're doing blood work. And again, talk to other people. I got a call from a viewer 2 or 3 weeks ago who had just been diagnosed with diabetes. And they said, you always talk about medical stuff. You know what you're talking about. I just got diagnosed with diabetes and I was given a prescription, but I wasn't given any nutritional advice and I wasn't given a blood testing kit. Is that weird? I said, well, let me check into it. Be happy to. So I did. Turns out, yes, when you are diagnosed with diabetes, your doctor is supposed to actually maybe send you to a nutritionist to be told what you should avoid, what kind of food you should eat. And you definitely, because I researched the drug my viewer was prescribed, and it specifically states in the drug instructions, test your blood sugar. So I called my viewer back and I said, yeah, you're supposed to be testing your blood sugar. And the viewer said, okay, I'll call the doctor. Doctor called my viewer back and said, no, don't worry about it. You don't need to test your blood sugar. Just take the pharmaceutical drug and we'll test you again in a few months. Oh my, I don't know. I think maybe that doctor needs to be fired. Again, your doctors work for you. When you get blood work done, does your doctor give you a copy of your blood lab results and go over them line by line by line, anything that's flagged high or low? Because both are, if a lab flags something. I had another viewer who had one thing flagged as high, but because the doctor never discussed it during the visit, and this viewer only got their lab results a few weeks after the visit, well, wait, that says high. The doctor never mentioned it. So I asked Dr. Google. And I'll tell you something about Dr. Google, guys. Not always accurate, not a replacement for a doctor, but I will say if you're concerned about something, you can ask Dr. Google, and you can ask Dr. Google 24/7. You can ask Google at 5 a.m. on Christmas morning, and Dr. Google will answer. And Dr. Google has actually saved me a lot of money in the past. When I cracked my ribs at the bay, when I had pain in my ankle that kept me up at night, it saved me money and time and frustration. And so far, Dr. Google hasn't let me down, but you have to be careful. So I asked my viewer, well, what was high? Let me Google it, and I did. And the funny thing is, again, with the labs, some labs are a little finicky. They will flag something as high or low when it's really not. Now, I'm no doctor, and I made sure my viewer knew this, that this is not a medical thing. But when I Googled this thing, you're actually not high, according to Google, according to people who actually have diseases related to this issue. This lab thought you were high, but you're basically right under the high. But I would ask your doctor, why didn't you talk to me about this? Now, if that patient, client, had the lab results in front of them during the doctor visit, then they could have said, well, wait, you didn't mention this. This was flagged as high. Why? That's a legitimate question to ask during your annual checkup after you get your blood done. Make sure that your doctor is not only giving you your test results in writing, but that the doctor, he or she, is actually discussing everything in those lab results. Instead, my one viewer said that the doctor kept talking about next year. Oh, next year you're going to be 40. You're going to need the prostate exam, your first prostate exam. Oh, next year you're going to be 50. That's not necessary, because remember, the meter's running. Remember Tuesday's show, the meter is running? It is not necessary for a doctor to waste that valuable time with you at your annual checkup to tell you what you need next year, what you have to look forward to. You know, shitting your pants and having a 16-foot snake shoved up your ass. You don't need to hear that today, because today is not about 12 months from now. It's about what's going on in your body today and how to keep you healthy and alive until next year when you need the 16-foot snake shoved up your ass. Right? Isn't that the way it is? It's today. Live each day as if it were your last. You know, if this is my last day, I don't really want to talk about shitting out everything I've eaten the last 2 years next year and having a colonoscopy. I want to talk about what's going on with me today. So I live to next year to tell you to stick your colonoscopy up your ass, because I ain't getting one. I mean, really. So don't waste time talking about shit that's not even in the moment. Get your lab results in writing. And make sure that your doctor is being thorough. Not only thorough in the testing that he orders for you, but thorough in explaining the results of those tests to you. And you're going to know it in your gut if something isn't right. You really will. And the best way to do it is to talk. Back when I had my pap smear misadventure, there was no Facebook. There were no support groups. I went to WebMD, which was helpful. I made some nice friends there, like Joe. But it wasn't all that helpful. Today, you can go on Facebook for just about anything, and there's a support group. And you can talk to other people who are where you are right now, and you can say, I just went to the doctor, such and such happened. Does anybody else have the same experience? And if they come back and tell you, oh no, you need to fire that quack, or and the Facebook people are very honest. When they have good medical care, they will let you know when you're not getting it. And the other thing I always say is, to me, smaller is better. And that's hard today, because all these health insurance companies are buying up these medical practices and these hospitals. When you call your doctor, do you hear Dr. Jones and Smith, or do you hear Penn Medicine, Lancaster General Health, Dr. Jones and Smith's office? Don't you kind of think it's a conflict of interest for an insurance company to own a medical practice? I do. I'd love to hear your points on it. Maybe this should be another show altogether, but I think that if the insurance company is paying the doctor's salaries, then the doctor has less incentive to fight for the client, you, when there's a discrepancy or a disagreement between what the insurance company is covering and the bill the doctor submitted with his coding, which we talked about on Tuesday. So think about that too. It's hard to find a small doctor's office these days. Everything is these big medical practices with several doctors, and you never know who you're going to get. It's sad. It is a shame. And it's something to think about. So I submit to you that if you are looking for a new doctor, instead of going on to the reviews, talk to your friends. Talk to people that are in your community. Ask them who their doctors are and what their experience has been with those doctors. And then, you know what? It might cost you a little bit of money. But it's kind of interesting because it would be a lot of fun to do it. And in fact, I am currently looking for a new family doctor. And I may do it. Ask to have a consult. Now, it might cost you even maybe $200 out of your pocket, but I promise it'll be worth it. Interview the doctor. Go in, sit down, interview the doctor. And don't talk medical. Don't talk about your aches and your pains or blah, blah, blah. Just ask a few simple questions. If I call your office with a medical question, how long will it take you to respond? Again, I called with a billing question, and I'm going on day 13 now, waiting for a call back for a simple billing question, which I think is a no-brainer. I'm still waiting for that call. And tomorrow it will be 2 weeks since my first call. And I've made very little progress. Now I have to start calling the people who sent me the bill and tell them why their bill isn't getting paid, because I'm disputing the charge. I think it should have been covered under the Affordable Care Act. But I can't get anyone at the doctor's office to return my call. They act like I'm bothering them. If that's the kind of doctor you want, go for it. I'll give you a name, PM me. I'll tell you a great doctor to go to if you want to be ignored. So you need to ask the questions that are important to you in a doctor. You need to interview the doctor before you sign on as a patient, because I'll tell you this. Most of us who are fortunate to have good health take it for granted. We do. I know I do. And then when we do need a doctor, we expect to just make a phone call, jump on in, and get the best care possible. We have no relationships formed with a doctor. That's unfortunate. It's unfortunate that doctors are so busy right now trying to see as many clients as possible that it's hard to get a relationship with your doctor, that they actually think of you as a person instead of their client number, their patient number. I still like client better. But if you are a patient, you must be patient, because you're going to be doing a lot of waiting for your test results to come back. I waited 5 months one time to get, 5 weeks to get a simple pap smear result. That was very important to me. 5 weeks. Called the doctor's office, come to find out it was sitting in his inbox, that he had other things to do and didn't have the time to call me, even though he knew that it was very important for me to know the results. That's how it works. Everybody's so busy. And it's okay when you're busy and you don't have time to return a call about the color paint that you mistakenly painted on someone's wall. That's not as bad as when somebody's health, their life is on the line. So please remember that when choosing a doctor, a medical physician, a family practice. This is your health, your physical and your financial health. So you need to really research and find someone that you can trust, so you don't end up being me. Me thinking that if only I had been political Paula in 2004 when my mother was killed. If only I hadn't had, people come to me now and they ask me to help them. And I can. And I couldn't help my own mother, because back then I didn't know anything. And in 2006, when I had my bad pap smear, I was not political Paula, and I didn't know anything. I learned, but I didn't learn fast enough to save my mother's life. I have to live with that. So for all of you out there, please Be an advocate for yourself. Doctors are not God. If your doctor is arrogant and it's his way or the highway, if you say, doctor, I don't want prescriptions, I'd rather do supplements, and he says, I don't believe in supplements, run. Because obviously, he's not listening to you. A doctor who does all the talking and no listening is not a good doctor for you. At least for me. I want my doctor to listen to me, not to talk at me. I want a doctor to give me suggestions, not orders. And at the end of the day, I want my doctor to be available. When I see my doctor, I want to feel like I'm his or her only patient, client, customer, and to remember to be nice to me because I feed your family. Political Paula, out.